Hello, good morning, Dr. Long. This is my presentation for the corrections final. And on my paper, I talked about cognitive behavioral therapy. It is a program that basically studies the inner emotions and thoughts of a person's mind. It's a short-term, goal-oriented psychotherapy treatment. It takes up to at least 5 months, and it's for problem solving, for emotional problems, trauma, a lot of different things. And it's not just offered to people who are criminals. You can get this type of therapy anywhere, whether you are a criminal, you're a ex-criminal, you're just, or you, even if you just feel as though you just want some help. It's just all about, it is really just all about what's going on in your mind and what's going on in here. When your feelings and your mind and your thoughts intertwine with each other and they create certain emotions, causing people to do certain things, that is what psychiatrist Aaron Beck studied in order to create this therapy session. He created it in the 1960s as he was creating, well, he wasn't creating, he was doing a psychoanalysis, noting that his patients would have internal dialogue, which is basically conversations within yourself. And he realized the importance of the feelings and thoughts being linked. He found that very important. So he came up with the term called automatic thoughts, which describes the emotional filled thoughts possibly popping up in one's mind. But he also studied his patients and noted that sometimes they were not always aware of these thoughts, but knew how to address them. For example, you're in a therapy session and your patient tells you that they're upset. They don't understand the thoughts that are going on in their head that created them to be upset, but they can sit here and tell you that they are upset. Excuse me. So when Aaron Beck saw that this was going on with a lot of his patients, he knew that the key to overcome individuals' difficulties was that yeah, excuse me. Aaron Beck saw that understanding a person's thoughts and feelings when they were not aware of them caused them to have certain problems and difficulties. So the psychotherapy program helps with juveniles, adult offenders, substance abusers, violent offenders, prisoners that are eligible for parole, and prisoners that are on parole. It is a program that's available with inside the correctional system with it's like a rehabilitative program. And it has also been shown to lower the rates of recidivism. Basically, having ex-convict not having to repeat the same offense over and over, or just even commit a crime over again, is just basically to lower those types of risks. When the criminal understands their thoughts and feelings and how they cause them to commit crimes, they sit and think and they become more self-aware and more self-conscious and more and their morals begin to rebuild. As Mark Lipsey examined how effective this program was in different types of interventions with youth offenders. He had 548 case studies and he divided them into several groups: counseling, deterrence, multiple coordinated services, restorative programs, skill building, and surveillance. As he compared and combined the results of the interventions, and the conclusion was that based on the punishment and the deterrence was how the recidivism increased or decreased. Criminal behavior was during this program was basically studied. You studying the mind of a criminal basically. And with this program, offenders became more aware of their crimes because of the behavioral therapy. They're more aware of their emotions, they're more aware of their thoughts. The therapy, okay, excuse me, I'm all over the place. The therapy sessions lasted about 50 minutes, up to 5 months. And during these therapy sessions, the patient and the therapist would come together and sit and try to figure out different ways to attack their difficulties and their problems and thoughts. Sometimes therapists would give the patients homework, whether it would be to write down the triggers of what causes certain emotions like sadness, anger, anxiety. Excuse me. Yes, sitting in therapy sessions for about 5 months, 50-minute sessions. I have lost my train of thought. I'm so sorry. hmm Also, the homework is to make sure the patient is engaged in the sessions, to make sure that the sessions are working. So the homework has multiple benefits: to allow the patient to see their problems. It allows the therapist to see that the patient is aware that they have these problems and these emotional triggers, but it also shows that the patient is very engaged in the program. And when a patient is very engaged in the program, it can help them benefit from this program. They can become eligible for parole, and then when they're eligible for parole, they go out into the world and they don't commit these crimes anymore. They don't commit any crime anymore because they understand those feelings that cause them to commit crimes, and they understand that they don't want to do those crimes anymore. This lowers the rate of recidivism with juveniles, adult offenders, violent offenders, substance abusers. The cognitive behavioral therapy program is literally made for any offender. And if you are eligible for that program, it is encouraged that you take the therapy sessions so when you go out into the real world, you will not go through that revolving door. You out and then you're back in, you're out, then you're back in. No, this is supposed to lower those rates with every category of an offender, not just one.